The Boko Haram insurgents in Nigeria has had huge negative impact on the lives of vulnerable young women and girls living in poor rural communities and IDP camps, making them depend solely on donations from people to survive, especially in respect with menstrual hygiene management. And now with COVID-19 outbreak, which has restricted access to these donations, these girls are forced back to the unhygienic means of managing menstruation. Things like using leaves, digging holes, putting ashes in the holes, and sitting on them until their menstruation period is over, including using dirty rags and among others. How did we provide help? We found Menstrual Cup. Menstrual Cup has become so far the most innovative and sustainable means of uninterrupted menstrual hygiene in hard-to-reach rural communities amid COVID-19 outbreak, and this is why we are proposing a scale-up. It is made up of body-friendly silicone which collects fluid instead of absorbs it, so ruling out the danger of toxic shock syndrome. It is cost-effective and is known to last for up to 8 years, saving these women and girls the heartache of running out of sanitary supplies, which only comes through donations. And these donations have been stopped so far, leaving them all vulnerable. Cups can easily decompose when disposed, therefore saving the earth from harmful materials generated by pads and tampons. We have seen that when young women and girls have access to menstrual hygiene, it motivates them to become champions fighting against stigmatization. Our ongoing menstrual cup distribution has already benefited about 2,000 vulnerable women and girls living in some IDP camps and poor rural communities across Nigeria. Stop Demand New Zealand raised funds, partnered with My Cup New Zealand, and supplied us with 2,000 menstrual cups during our pilot phase. We then randomly selected hard-to-reach rural communities and some IDP camps, trained our recipients on the proper use and maintenance of the cups, including the techniques of insertion and sterilization. Afterwards, we distributed these cups for free. Our impact assessment survey has shown that menstrual cup is the most sustainable means of managing menstrual hygiene in poor and low-income rural communities. Having in mind that sustained access to menstrual hygiene will not only give these women control over their sexual health, but will also prevent infections and other medical complications that result from unhygienic means of managing menstruation. Sustaining menstrual hygiene is one of the major keys to a healthy sexual and reproductive lifestyle.